This is Dr. Vijay Kumar speaking. I am a practicing physician at BTM Layout, Bangalore South. My main area of practice remains diabetes. Today, I've been asked to talk about two significant concerns. One is the gastroesophageal reflux disease, or they also called it GERD, GERD, and pulmonary fibrosis, commonly known as PF. First, let's talk about GERD. This is a long-lasting condition in which stomach acid frequently flows back into the esophagus, causing symptoms like heartburn, sour liquid in the throat, stomach pain, that is the upper pain, upper stomach pain, dysphagia. When it is nocturnal, it can cause cough, laryngitis, difficulty in swallowing, and sometimes it will exacerbate bronchial asthma. If left untreated, the acid reflux can irritate the lining of the esophagus and over time cause the damage that may extend beyond the digestive system. About pulmonary fibrosis, on the other hand, is a serious lung disease where there is scarring of lung tissues over time. This scarring makes it difficult for the lungs to function properly, leading to breathing difficulties, tiredness, and in advanced cases, severe breathing issues. Pulmonary fibrosis can result from various causes. Some of them are, first, you should understand that there are two types. One is the idiopathic pulmonary fibrosis, where the cause is not known. Second one is because of the many causes are there, where some of them are toxins, the pollutants. People work in industries where there is silica dust, asbestos, metal dust, wood, burden, and some of the drugs like nitrochlorothiazide, ethambutol, sulfasalazine, even methotrexate, most of the immunosuppressants, they do cause this. There are some connective tissue disorders like dermatomyositis, lupus, polymyositis, and sarcoidosis. Over the time, this scarring makes it difficult for the lungs to function properly, leading to breathing difficulties, tiredness, and in advanced cases, severe breathing issues. Pulmonary fibrosis can result from other causes, as I told you. So, what is the connection between GERD and pulmonary fibrosis? Well, studies indicate that there is a significant overlap between the two. People with GERD are often more likely to experience lung issues due to aspiration and sometimes inhalation of stomach acid into the lungs. This repeated exposure of acid can contribute to inflammation and even scarring within the lung tissue, possibly worsening pulmonary fibrosis. Patients with pulmonary fibrosis often experience increased GERD symptoms, and this may be partly due to their body's weakened state and reduced lung capacity. When GERD is present in a patient with pulmonary fibrosis, the progression of fibrosis can accelerate, making it essential to manage symptoms of GERD effectively. One approach in managing GERD in patients with pulmonary fibrosis involves lifestyle changes. These include avoiding certain trigger fruits, foods like spicy and acidic foods, caffeinated drinks, and alcohol. This can worsen reflux, eating smaller meals, avoiding lying down after meals, and elevating the head while sleeping can also reduce acid reflux episodes. For more severe cases of GERD, medications such as proton pump inhibitors or histamine receptor antagonists may be prescribed to reduce the stomach acid production, and in some cases, surgery also may be considered, especially if GERD remains uncontrolled. It's very important for people with pulmonary fibrosis and GERD to collaborate with their healthcare providers to develop a tailored management plan. Early intervention and management of GERD can potentially slow the progression of the lung damage in the patients with pulmonary fibrosis. In conclusion, GERD and PF are both complex conditions with a huge impact on quality of the understanding. Their connection can empower benefits to the patients and help providers to make decisions that would improve health outcomes. Basically, you have to control your acid reflux disease initially, unless you are exposed to most of the other things which cause pulmonary fibrosis. So, when the cause is known, pulmonary fibrosis is definitely preventable. Otherwise, there is no definite treatment for pulmonary fibrosis. So, thank you for joining us today to learn more about this important topic. Thank you very much.